Fibromyalgia is definitely what I call a new millennium disease. It is a name given to a group of symptoms that usually consists of someone who is hypersensitive to pain. If you haven't watched any of my videos on MCS, multiple chemical sensitivity, or chronic fatigue, I encourage you to do so because these symptoms and conditions are very tied together. Matter of fact, honestly, the cause is the same. The etiology is the same. Matter of fact, the treatment is the same. With these conditions, we are looking at neurotoxins that affect our nerve system, which causes a group of symptoms that really can change per person even upon genetic susceptibility. Fibromyalgia is absolutely grouped into what I call a neurotoxic mediated illness. It can be caused by many different types of toxins, all which are neurotoxins. It can be caused by biotoxins, either from Lyme disease, or it can be caused from a biotoxin produced by mold. It can also be caused by heavy metals such as lead and mercury. If you haven't watched those videos, please do. Because see, when we treat these conditions, we don't want to just take away the symptoms. We actually want to get to the cause. These types of neurotoxins, even pesticide poison patients, can trigger something called the no-ono cycle, which is simply an inflammation oxidative stress cycle that gets triggered in these patients, which is really the responsible for why we see the symptoms that we do. Look, I'm going to make it as simple as I can, and I do encourage you to watch the other videos, but here's the treatment. In the past, we've had a theory that our body accumulates certain toxins. However, that theory really never gave us a good etiology for why we see different symptoms in different patients, even with the same toxin. So medical community had a problem with that. Today, what Martin Pall, a really brilliant biochemist, calls the no-ono cycle, we refer to it, he refers to it as the 10th paradigm in medicine, and I couldn't agree more. There's 9 accepted paradigms in medicine right now. This is the 10th, which gives us a true etiology for chronic fatigue, fibromyalgia, and all these unexplainable new millennium diseases that are just plaguing our country right now. However, this old theory of really bioaccumulation, or what I call filling our bucket full of toxins, still plays a role today, plus the no-ono cycle theory, which is just an inflammation oxidative stress cycle that breaks because of the exposure to toxins. Now, I believe that it is the use of these two types of really theories or treatments that is getting these patients well, at least in my clinic, and also the doctors who I train, their clinics as well. You have to get rid of the toxins that have bioaccumulated. That's part one, or at least part of the treatment. However, if you don't downregulate this vicious cycle of inflammation and oxidative stress, you will not get the patient well. Doctors who are listening, listen up. For years, we have gotten rid of the toxins, but you still are not able to get many patients well because you haven't downregulated this cycle of inflammation. However, I'll say this as well. You can downregulate the cycle, but if you do not rid the body of the toxins that have stockpiled there, you will be unable to get the cycle completely downregulated. And one of the reasons why we see an ongoing of symptoms in people who just don't feel well, even though they've done years of detox, it's because they've really never successfully treated this no-ono cycle. It is the combination of the treatments is what I do in this clinic. It's the combination of treatments what I teach doctors all over the country. It's the combination of these two treatments is how I got myself well and how I've gotten so many well. I hope that helps, and I have a real interest in these new millennium conditions. Why? Because I've had one. If you haven't read my story, please do, and I hope that helps.